Hey guys, we're in the OR today doing Gladiator makeover. We're gonna sculpt out this guy's six-pack, give him a V-taper, define his chest, and take fat to define his arms, buttock, calves, and chest. Stay tuned for an amazing transformation. He has some glands that need to be removed, so our plastic surgeon is gonna come in and tighten the chest area, giving a more defined border and less puffiness. This is something many of my athletic males want. This is not fat removal, this is sculpting and defining lipo. Hey guys, it's Dr. Emer, beginning of the week, and we're doing a male gladiator makeover today. I'm really excited because he's had no surgeries before. There's no scar tissue or indentations or irregularities like a lot of the cases I'm seeing recently. We just have a muscular athletic guy that wants to get that gladiator, that shaping, that athletic look. He has a great six-pack underneath. We're gonna define it out naturally. We're gonna sculpt out the chest, get it tighter, get rid of those glands, and make the border really defined. And we're gonna remove fat around the waist and the sides, the love handle area, giving him that hourglass or at least that soccer butt shaped look. We're gonna define the dimples of his back. We're also gonna give him really muscular arms. He's got the muscle underneath there, but we're gonna create the indentation. So stay tuned for this amazing transformation. Chest, make sure we get really sculpted. Now we're going to focus on areas guys hate the most. Besides having their six-pack is the sides. I'm going to turn all the way around a little bit. Get this back here, and the entire area here, avoiding going too lateral on here. Same thing here, medial here, not going too lateral. Good, focusing more on the handle, on the muscle. So he's really defined for a much longer period of time. So stay tuned for this amazing makeover. It's a primary athletic look. Hey guys, it's Dr. Emer. We're doing a male gladiator lipo today. You can see I got my surgicalcaps.com snowman hat on. We're getting ready for the holidays. We are swamped with surgeries for the next few months, so I'm really excited to show you this case, because this case is one of the cases that I love to do where there isn't a previous liposuction. He doesn't have scar tissue. He's got really tight skin. He just has some small problem areas of fat. So we're gonna remove fat from those areas like his stomach and sides, his lower chest where it starts to get a little saggy, and then we're gonna define his arms. We're also gonna use fat to build his chest, his arms, and his calves. A lot of guys that are very muscular have some thinner calves, and he really wants that built out. His buttock is amazing already. It's lifted, it's a soccer booty, but it doesn't have those dimples, those Venus dimples, so we're gonna define them. If we have a little fat, we'll use it there too. Some of the guys that I'm gonna answer this because a lot of people are asking lately what else I can do with the fat. A lot of times I'll use that fat for the penis area. This is called penile rejuvenation. We're gonna do that in similar cases, so stay tuned for that as you're watching our snap. But today our focus is his arms, his chest, his calves, get him really muscular looking. He's got an amazing six-pack we'll be able to define out. The border of his chest will be improved because we're gonna remove his glands, we're gonna lift the nipples and define the border. A lot of guys, as they age, get sagging there and get puffy nipples. We gotta get rid of that so he gets a more athletic and muscular look. And then his shoulders and arms, we just wanna define them. Look guys, super muscular and athletic. You can't even see his six-pack, which is why he wants to do treatment, but it's there. He's got super large muscle under here. And also notice the angle downward on his chest. We're gonna get that to lift up and create more of a border by lifting the nipple and removing the gland tissue and also taking all this fat and getting rid of it. On his arms and back, he looks great already, but we're gonna get rid of this fat through here. We're gonna sculpt out this triangle, the lower border of his buttock, and give those dimples some size. And then we're just gonna sculpt out his arms. Over here, what's gonna be amazing is these shoulders will pop and we'll make much more of an indentation here and define out his tricep. We're then gonna go to his calf area and define out his calves. I'll show you a better view of his calves in a moment. But we're gonna get this waist, we're gonna bring it in, define these dimples, and make his six-pack much more sculpted. I'm super excited about this gladiator makeover because he's got tight skin and not a lot of fat, so it's gonna look defined. For such a muscular guy, his calves are really small. The hard part about this is the muscle of his calf is actually not, it's very compact. It's like right here. So you can't really put a ton on both sides without it dying. So we're gonna place in what we can, especially to the belly of the medial and along the length of the lateral portion. Hopefully at least 50% of it survives and then allows him to work out. and get a bigger result long term. You can store the fat and do subsequent treatments. We're not gonna have enough since we're using the fat for all these other areas. Our goal is to at least get him a little bit more bulk so he has more sustainability when he gets to the gym. So stay tuned for today, guys. It's a great male athletic lipo. Super excited about this holiday result that he's gonna get. My surgicalcaps.com cap is going to make it a really fun case today. He's gonna be defined by tomorrow. Follow on Instagram so you can see how he looks even the next day. Still adding more tumescent. We're gonna fill up the whole front of the body, get it all super wet so that we can remove the fat and sculpt. Remember, the tumescent has medication in it that helps us get the fat out safely and also makes it so that when so it's a little bit harder to see the results if you don't use an ultrasound like this that can go really superficial and get that dermis fat. So it's really important you do this for sculpting, especially in cases where we want to get a... We're almost finishing the visor part. We're getting the sides of the chest and his lats. You can see we're really bringing them in. Here's his lats muscles right there. Really shrinking the sides, really getting it to be tighter here so everything gets more defined and I can really tighten up the chest. Now we're starting to shape out the border of the chest and the upper abs. Remember I said before, this area needs a lot of really sculpting and kind of to lift the chest, so we are going along that border and really getting it tight. Now we're sculpting the chest, and a very important part of this is getting not only the chest itself, but the sides of the chest, the armpit areas, and the upper back to make the chest look more athletic. That's going to allow us to give him a more sculpted look and also get his lats to be really defined. Sculpting out the abs now, and so it's very meticulous here to get the exact shaping we identified together at the beginning. He is very muscular, so we actually do want to leave a good amount of fat on his abs. And so right now, you guys can see they're starting to come in and be nice and chiseled so he can have that definition that he was looking for. Now we're heating on the muscle to get the abs to tighten up more. You can see where the abs are and how flat he is on the lower part. Now we just want it to be more defined. So we're gonna heat all the insertions and get it to tighten up over the next 6 months.
Turn it again and load it up in syringes and it's ready to go.
Now we're going to add fat to the calves, and this area tends to be a little harder to keep the fat, so we try and do superficially and a small amount, because if you overdo it, it won't survive. Now we're adding fat to the upper chest just to give him a little bit of a shelf. He didn't have a lot, and it's very fibrous, so we'll do our best to give him some level of shaping here. Now we're doing the tumescent fluid, which is the first step in doing the high-def lipo. This fluid has materials in it that helps decrease the bruising and the swelling, but it allows us to get rid of the fat more safely. You can't do lipo without it. It will cause a lot of bruising. So this is the first step to doing all the areas that we're going to remove fat. sound. If you listen closely, you can hear it pulsing. That pulsing under the skin is what's going to break apart the fat cells and get them ready for fat removal. It's also because the skin is a lot thicker, it's very muscular. Now we're getting ready to be finished with the vaser on the one side. Take a look already. You can see a significant reduction in the hip here, a lot of thickness here, but on this side it's much thinner. We've definitely been melting the fat. Look at it coming out, the vaser port. So one side, the waist is much smaller. The other side is getting ready for treatment. You can see a huge difference already in just a few minutes. Now we're doing the vaser on the arm to really get that shoulder to come in. Remember I said really aggressive along the bicep, along the insertion, behind the shoulder. You can see already, take a look. Foam is bringing out that fat. See it? Look at that. All liquid gold. Now we're removing fat from the back, and we're also going to go to his arms. He's not going to have a ton. Remember, he's very muscular. The idea here is remove what we can in the problem areas and then get to those dimples. We did the ultrasound so you could see. Now we're moving fat all around the arms and upper back. This gets the rear delt area so it gets more defined, and it gets some of the fat in the upper back area so the shoulders and back get more muscular. Now I'm defining out his triceps. You guys can see the deltoid is much more improved. Now we're working to bring that tricep skin down so that when he is flexing, it's really more defined, but even at rest, you can see it more. Yeah. So now we're doing the Renuvion internal heating, you guys. It's hard to see his darker skin type, but this has an internal flame that's contracting the tissue, making it tighter. In this case, since he's already tight, it's really just going to even everything out and make it look really blended and more sculpted. You don't want to be too aggressive because he could be left with indentations. So by doing the Renuvion, he'll less likely have that, have a more smooth of result and a tighter, better result. So he has really big shoulders, but we really want those gladiator arms. You guys can see that we have sculpted the shoulder out, the indentation are there. Now we're gonna really put volume into the deltoid. It'll be very apparent when we're completed. So now this side has the fat. Take a look, show them, pull back a little bit, show them the roundness. Look at the angle here, deltoid, tricep. Take a look at this side. It's sculpted, but it's not as bulky here. You can see it's soft. Take a look at this. Nice and hard. That's what we're going to do over here.